Katie, thank you very much for your time, and thank you for agreeing to be with us and share all the work that Feeding America is driving to help America on this fight against coronavirus. As we go through this crisis, what is the current situation that America is facing on this fight against hunger?
A snapshot of what we're currently experiencing is prior to COVID 19, we knew that there were about 37 million Americans who were food insecure. Post COVID 19, and with the 16 million unemployed now, I think as of today, that we've seen happen over the 2 to 3 weeks, and the impact on our network, we estimate that there are an additional 17 million people who are facing food insecurity right now. That's a 46% increase. At the same time, this situation has created a perfect storm for the charitable food assistance system. And in that, it has three elements. One is that demand is surging all across our country simultaneously, with our food banks reporting um, an average over 60% increase in demand that they're seeing in their communities. Secondly, our whole model is based on donated food. And because of the pressures on the supply chain, the donated food is down anywhere from 40 to 60% flowing into the charitable food assistance system, which is creating a situation that is not sustainable with tremendous increase in demand and a rapid decline in inventories and available donated food. And then third, our operating model is one that relies on volunteer support and congregate solutions, where people come in and donate food and sort food and pack food and distribute food in masses. And we have had to innovate and deal with about a 70% decline in volunteers that are available right now, and new ways of doing that. We are doing that. We are making progress, but we need a great deal of help to meet demand, to access food, and to make sure we have the human labor available to get food to people in need.
So you mentioned COVID-19 and all the impact that has actually also happened in the economy. How much that'll change on your day-to-day?
Um, I can tell you that it has completely consumed our entire organization. Um, I am leading our COVID-19 response efforts, and they are comprehensive to who we are and what we do now. And we wish that weren't the case. We have some streams of work that are continuing, but they are very minimal compared to how we have repositioned ourselves and our resources to support food banks and the 60,000 agencies that work with those 200 food banks across the country. So what that means is we've rematrixed the entire organization, frankly, redeployed staff, gone through an entire staff assessment, found where we had capacity that could be redeployed and redeployed it accordingly, set up new reporting systems, communication vehicles for our networks, webinar opportunities, technologies via help desk, an emerging practice functionality so that food banks can share very rapidly in real time how they are innovating solutions on the ground. So it has had an incredible impact on how we work.
You mentioned the challenge ahead and some of the innovations that the food banks created. What surprised you the most? What excited you on, wow, we have hope that actually we can actually beat this? What would be like the biggest highlight so far?
So I have not been surprised, but I have been elated to see the resiliency and the perseverance of not only staff and people who work for our food banks, but folks need to know that our entire charitable food assistance system in this country depends on about 2 million volunteers a year and 60,000 agencies, many of which are volunteer led and run. And these folks all across this country are showing up. We have adapted and innovated health and safety protocols for sorting food, receiving food, selecting orders in the warehouse. We've got one of the neatest innovations has been that many food banks have turned to 24-hour warehouse operations. Typically, they don't do that. And it is for the precise purpose of making sure that there's sufficient physical distancing when warehouse selectors are pulling orders. Other innovations have been in our distribution space, where we are getting to a point where we are really perfecting in a lot of communities low contact or no contact distributions. I'm sure people have seen videos of lines of cars all across this country lined up to receive boxes of food. And that has been an innovation, again, led by our tremendous network of resilient leaders.
And unfortunately, we're still in early days of this challenge. What concerns you the most?
So our greatest concern is food. Um, we have been incredibly blessed and grateful for the financial resources that people are giving. And our model estimate for the first 6 months, when this first started in March through September, I think, as you know, we're looking at a $1.4 billion shortfall or gap in what we need to keep the charitable food system afloat and meeting the needs that are being presented at our food banks. We are seeing incredible skyrocketing in need all across the country. That is a challenge, but the greater challenge right now is that we are worried we may not have the food we need to get to our food banks and to their partners to meet that demand. So when this started, as you can imagine, all food banks' inventories were not in a place that were ready for a sudden and skyrocketing surge in demand, where on average, I would say we're seeing 30% more people showing up for assistance, and that varies across the country, most of which are new to ever having asked for food assistance before. Where we have been able to see real opportunity is in perishable food, especially from the food service industry. Produce, dairy, protein, consumer packaged goods that are frozen, those kinds of things are becoming available to us, and they're great. But for our lower capacity system and partners, freezer and cooler storage and those sorts of things present some logistical challenges, but we are moving that food. What we really need is shelf stable food in addition to that, for those emergency boxes, for those low contact, no contact distributions. And that's where we're challenged because of how tight the supply chain is right now as it relates to dry product and shelf stable food.
Very clear. Any final thoughts?
Sometimes it's difficult for people to recognize how critical access to food is for people's day-to-day life when they're faced with this kind of economic disruption, and frankly, how critical access to food is to maintain healthy communities, social order, people's sense of stability and ability to persevere through these kinds of challenges. So what I would close by saying is, when we are working to help make sure food is available to people, it is first and foremost to make sure that they are not going to bed hungry or having to tell their children that they don't have food to feed them. That is a horrific circumstance that we don't want anyone to be in. But it is also because it helps us as communities in a country get through this. It helps to keep panic at bay. And so providing food assistance is good for the individuals who are impacted, and it is good for our communities, and it is good for our economy. And so we're really grateful for anything that the audience can do to help make sure that we are flowing that food to the people in need right now.
It's a very powerful message. So thank you so much for all the work that you do. Thank you for your time. And as you said, let's beat this and find the food for people that need tomorrow, not 3 months from now. Thank you.
You bet. Thank you.